be kept up to date on those vaccinations. It's very important.
Yeah, we have pharmacist Jayme Garcia here with us this morning to explain the importance of getting kids vaccinated. I'm from a big family. I have no idea how my parents kept track.
Oh my gosh, it's a lot for parents to
But there are
manage.
necessary things, and then there are other options.
Yeah.
Why is it so important that kids get vaccinated?
Well, vaccines are prevention. So really we're talking about some really big diseases that we can prevent through vaccination. And back to school, we have to think about really two age groups. We have our kindergartners that are going in, and they need to get they need to complete series that they started as infants before going into kindergarten. And then our 7th graders, so 11 to 12-year-olds, before they enter into 7th grade, they should be getting a meningococcal vaccine, which is going to prevent against meningitis, which is a bacterial infection of the brain and spinal cord. They also need a Tdap, which is tetanus, diphtheria, and pertussis. Tetanus we think of when you get an injury, yeah, and you can get, so that prevents that. And diphtheria and pertussis are airborne diseases. Pertussis we know is whooping cough, so they're going to be prevented against that, as well as HPV, which is a human papillomavirus. That's a cancer-preventing disease. It's recommended for males and females, and it can help prevent cervical cancer, oral pharyngeal cancers, and it's like
6 different cancers.
So many,
right?
so many,
More
yeah,
now.
yes. And the cool thing about the HPV for our 7th graders going in is that if they start the series before they turn age 15, they only need 2 shots. If you get it after the age of 15, you have to do 3. So it's a good time to, as you're getting back to school, it's a good time to go in and start these series.
Get it all done.
So what's a good plan in tracking down whether they've even had some of these vaccinations?
Yeah, being a parent is really hard to manage all of those and all these big words. Our pharmacists are really there to help you. Our pharmacists have access to our state database, which will show what vaccines have been given in the state of Utah. If you're from out of state, any records that you have, we can help reconcile and see, oh, you might be due for this one, or it looks like there's a gap here. But our pharmacists will be the ones to know. We don't expect that parents are going to know at age 4, age 5, this is what's needed.
Right.
And leave it to the medical professionals, but we can help reconcile that for you.
So the state does keep record of each one?
Yeah, so vaccinating pharmacies, vaccinating doctors' offices will upload those records to the state, and then we can look at that to really help close the gap. And go ahead.
Well, I was going to say, what if there's a situation where a kid hasn't really received hardly any of those vaccinations?
Yeah, we see that as well, and it's never too late to start a series, or if there's been a gap, you never have to restart a series. So let's say you got 1 dose years ago, and you never need to restart it. We can just kind of pick up where you left off.
Okay.
And what about something like measles, where we've seen a resurgence and outbreaks because some people were unvaccinated?
Yes. So measles, mumps, and rubella, that's another one that going into kindergarten, your kindergartners are going to complete their series or maybe even start it. We really look to the state to see what is going on in the area to know if vaccination is necessary, but we are seeing pockets of it due to low vaccinations that it is surging up. So it's not only helping you and helping prevent illness in you, but also your community.
Well, and I know some kids with compromised autoimmune system,
Yes.
or that they can't get vaccinated, and I've heard that if your kids can,
Yes.
that helps protect them. Is
Absolutely,
that how it works?
yeah. Well, because there are a few vaccines that are considered live vaccines where someone with a low immunity or are unable to get it. So yes, you're not only protecting yourself, but you're helping protect others in your community and within the school.
Okay, what about COVID-19? Do kids need to get that?
Yeah, so COVID vaccines are recommended. We are currently with the CDC. They're recommending it for everyone 18 and older. For children, they want you to work with your healthcare provider to know if it's something that they're needed. If they've never been vaccinated for COVID, or if they've never had COVID, then it would be a recommendation to get. And then annual flu vaccines are recommended as well.
Oh, sure. As far as COVID-19 goes, are we really seeing many cases of that now?
Gosh, summer COVID, I think, is something that we're seeing a bit. I know of many people just in my inner circle that have had positive COVID tests now. And so COVID is definitely something that we're still seeing, and vaccinations are available. We currently have the 2024-2025 COVID vaccine available. We're patiently waiting for the CDC to tell us what's going to happen for 25-26.
And the flu's probably even more dangerous.
Yeah,
times. Yeah.
flu can cause hospitalizations. So it's a preventable vaccine to help. And we have those in stock now. So even when you come in for your back to school vaccines, we can get you started on, we can get you your annual flu vaccine as well.
Yeah, the flu kills thousands of people every year.
It does.
Yeah, and the vaccine just helps prevent it.
Yeah.
Helps reduce your risk.
It reduces your risk for it and
And we
helps
old people
prevent.
got to keep up to date on vaccinations too.
I've got mine.
It's true, yeah.
Okay. Thanks so much,
right.
Jayme.
You are
And
so
if you
welcome.
ever have a question, ask your pharmacist.
Yeah, come ask
Yeah.
us. We will help you. we're the experts and we'll help you close the gap.
Okay.
We appreciate that. Thanks so much.
Thank you.